Singapore is reviewing its safe management measures as it learns to live with COVID-19. For instance, safe distancing rules for F&B establishments will be relooked. TraceTogether may be phased out, except in vulnerable settings like schools. But that's if cases subside further. And that's because TraceTogether is no longer used for contact tracing, but it is still useful in identifying settings more susceptible to spreading COVID-19. Other measures like SafeEntry and vaccinated-differentiated safe management measures, or VDS, will still be needed. That's because people who contract COVID may still fall very ill and require hospital care.
When we are sure that the situation in hospitals is stable and improving, we will review the VDS and consider if we can reduce the number of settings or remove it completely. Then it will be a matter of individual responsibility of these non-fully vaccinated individuals to take precautions to avoid high transmission settings, or better still, change your mind and get vaccinated.
Mr. Ong added that only 3.5% of Singapore's adult population is not fully vaccinated. Members of Parliament questioned if VDS is still necessary, given that vaccination rates are unlikely to rise further. Mr. Ong replied that measures are in place for now to protect public health.
In the hospitals, it is still a crisis situation. It's very busy. Every day you have hundreds of people coming to emergency department, but that is the outcome of 2 over years of focusing on COVID-19. The business as usual workload has built up. Chronic cases has become more serious. So hospitals are now busy. Healthcare workers need all our support. So while we understand it's not exactly an equitable situation when you look at businesses, you don't want at this point to add workload to our healthcare workers.